Angioplasty involves risk. In fact, sometimes the procedure causes the event it's trying to prevent because the balloon nicks one of those plaques and all the toxic ingredients spill into the bloodstream. You end up with a clot. In fact, about 15 to 20,000 times a year, people have a heart attack right on the table, and 10,000 of them die. Now, frankly, most people don't die. We do about 500,000 angioplasties in this country every year. But what happens to the people who don't die is that 50% of their arteries clog back up in 6 months. 6 months. All right, why is that? Because people leave the hospital and go home, and before they leave the hospital, their first meal is meatloaf and sausage gravy delivered by the cafeteria, and then they go home and they continue to eat the way that they did before. Now, this study was amazing, and there are several like it in the medical literature. The AVERT study showed that people who just took Lipitor, the study was designed to see what happens if you give this group Lipitor and this group angioplasty. The people who just took Lipitor had a much lower risk of heart attack, readmission to the hospital, and death. Now, remember the efficacy rate for Lipitor? 1.6%. We actually in medicine have designed a procedure that costs tens of thousands of dollars that is less effective than a drug that has a 1.6% efficacy rate. This is hard to do, folks. This takes incredible American ingenuity to come up with this stuff. Bypass surgery? Here's the problem with bypass surgery. It bypasses the arteries close to the heart only that usually have calcified plaques that are unlikely to rupture. But the bigger problem is that with cardiovascular disease, coronary artery disease, if you have it in one place in the body, you've got it everywhere. All right? We do not have a roto-rooter system that goes through the body and routes out all of the garbage that lines your arteries, like the roto-rooter system that will come clean out the pipes in your house. So you really don't fix the problem. And in fact, 3 major studies have shown that bypass patients after the surgery really are not better off than people who just take drugs. Now, there are applications for all of these things, and I want to make this perfectly clear before we go to the next thing. We should do bypass surgery, probably 15,000 times a year, not 500,000. We should do angioplasty, probably 15,000 times a year, not 500,000. Some people should take statin drugs if they have familial hypercholesterolemia. But you see, the problem is if you just did these things or gave these things to people who qualified, you can't make billions of dollars. The money is in doing it for everybody.